Perfect.
I'm glad it's you and not me.
All right,
All right.
welcome everybody. We are here with Susan and Liza. They are adult warriors. They're going to tell us a little bit about their stories. Just a disclaimer, no one is providing any direct medical advice here. Any questions or concerns should be directed at your own medical providers. But let's go ahead and start with April.
Okay, so I'm gonna try to make this fast. I didn't actually time it. I was like, oh, I should have probably timed it. So my name is April. I'm almost 49. I'm in Kamloops, British Columbia. That's 4 hours north of Vancouver. Um, so I'll just kind of read. I might leave or add some things out. So I'm the oldest of seven children. My parents live and lived in the sticks. So I'm in Kamloops and they live 2 hours away. And my mom had a really easy pregnancy with me. They weren't sure of her due date. So the town next to my parents is Clearwater, which is very, very small. And so the next one would have been Kamloops, this city here. And they had just got an ultrasound machine, a still ultrasound, wasn't even a moving one. My mom just told me that yesterday. And my doctor's like, well, why don't you, my mom's doctor, he's like, well, why don't you go in and get your, they just got this brand new ultrasound, go in and get your dates checked. So she comes in and basically that's what they found out happened is that I had this omphalocele. Um, and then, so of course they didn't know essentially how much, but they did say I had a full abdominal omphalocele. All my organs were affected from the bottom of my liver to the top of my large intestine. Um, the peritoneal sac was intact at the time in utero, but during birth, it did burst. So they were unable to have my mom deliver. So my mom's doctors suggested that, well, he didn't suggest, he said you will have to fly down to Vancouver. And at the time there was, anyway, it was just easier to fly. So they also were told there was a doctor there that had the best survival, a surgeon there that had the best survival rate for O babies that were from like west of Toronto hospital. So he was like one of the best surgeons. So my mom flew down. I was born in Vancouver General Hospital. There was no children's hospital there at the time. Um, Mom chose to have me vaginally. Um, they asked if she wanted a cesarean and she opted out. And that's probably why the sac burst. Um, Mom said I cried right away. And they put like this Teflon bag. I say it's kind of like a bag of oranges or bag of avocados over my stomach. And they twist tied it with like a medical grade twist tie. Um, she was only able to touch me, was able to hold me. Or so she was finally at Christmas. She was able to hold me and give me their first bath. But for the first 6 months, like I was born in June 76. So for the first 6 months, mom couldn't even hold me. I was immediately put on a ventilator. My lungs were also plastic, so they weren't inhaling. This is basically what kept me in the hospital. I don't want to scare anybody for 21 months. If it had just been my omphalocele, I probably would have been home in about 6 to 8 months. But I had a lot of heart breathing issues. So like I said, it just kept me from coming home for 2 years. But that's just my story. Obviously everybody, I hear a lot about babies. Oh, they're home in 4 months and 6 months, and that's fabulous. It's not to scare you. So I was kept on my back the majority of the time. I had many cardiac arrests because of my heart lung issues. They say I had probably 12, maybe even more cardiac arrests, which kept my brain from, which we know now, probably caused a bit of brain injury. I'm trying to, that's where this. Um, so at about the time, it was 8 hours. Vancouver was 8 hours from where my parents live. Um, and so mom would come down about once a month to visit me in the hospital. Um, for the first 6 months, mom says I was fed intravenously. And then after that, from like a year to 20 months, I was fed via NG tube. And then once I got a hold of food, I just couldn't stop. So there you go. Um, and what else? When I was, so as far as my parents were encouraged, so I was the oldest. So my parents were just encouraged to go home and live their life as a married couple and just not say don't worry, but don't spend all their time, you know, worrying about me and being with me. Um, that's a lot. That's a whole other attachment issue that I have. Obviously, they say different things now. Um, they would call a couple times a week to see how I was doing. They actually were discouraged, especially in the beginning, to not take any pictures of me. And but they only have but they've taken lots of pictures. I have lots. And then what else? Uh, so then when I got home, so I got home when I was 20 months old. My mom was actually pregnant with my brother at the time. And so here she is, this 23-year-old mom with this medically fragile baby in the sticks and pregnant, probably sick. So she was taught by the RT, respiratory therapist, to suction me. And I actually remember being suctioned and like, let's say beating, that's not the word, but she would put me on her knee and she would like pat my back. I actually quite liked it to get all the air, all the fluid out. I didn't crawl, I just scooted. When I was 2, I had my tracheostomy closed in. When I was 4, I had my big surgery. Mom thought it would be 3 or 4. Still done at the general hospital because there was no children's hospital that built then. Um, I remember that too. And they basically used Teflon to just put everything in. And I do have a gnarly scar, but it's is what it is. And they probably could do a way better job now. But again, it was in the 70s or 80s now. Um, Life for me now is I did get sick. So most of my teen years, I did pretty well. I had a couple lips. Um, when I was 31, I got really sick, hypoventilation, which basically meant I couldn't breathe at nighttime. And I found out later that 30% of, now I don't know if this is true, if it's just what I remembered, 30% of omphalocele people can have this, which is you just don't breathe at nighttime because your stomach is all like, it's just all, it doesn't have those muscles to breathe. So I have a BiPAP machine and it's made my life like way better. I could have had children probably, but life happened and I did get married, but there's lots of things happened and we didn't have kids. It probably would have been a difficult pregnancy, but I probably could have done it. So yeah, partly like when I was little, you wouldn't know it now, but when I was younger, I actually did a little bit of track in my elementary years and a bit of soccer. So I did play a little bit of sports. Yeah, I was pretty active when I was a kid. We lived on a farm, so lived on a ranch. So after I was about, 5, 6, I was able to do everything, that everybody else could do. So yeah, that's the short version. I would just say, and I think everyone's doing it, ask lots of questions. Um, Family members of God, get all your family members involved, which Corinne sounds like you're doing awesome. Um, yeah, be there, obviously be there, but you can. But yeah, you do need a night away. You don't, again, the longer the baby's in, you'll how to say, you'll need that time away, right? So it is important to have that time away as a couple or as a family. Um, get the kids involved, but don't burden them if you have younger or even older kids. If they can help with things like, you know, padding and suctioning, it's easy to put them on your stump on your lap and just my mom would just put a towel on my back so it wouldn't hurt as much. Um, and get them involved and get them aware. Like even now, my all my siblings are very aware. Obviously, when they were younger, they were very aware of what I had. Um, even when we were all kids. Um, yeah, don't rush the baby coming home, but be on them as well. Like I remember mom kept saying, "Okay, well, you said that this certain time we could take her off the ventilator," and they finally did. And you just have to be on them. As we know, you still have to be advocates for your own family and for your own health. Um, and of course, this is what I just realized yesterday. Like, if you can, obviously there was no Facebook back then. But if you can get them involved with or around other kids with O kids, if you can get them around other kids with who have O's or families, do that. I felt very isolated. I don't think I've ever met anybody with an omphalocele ever. So this is why I wanted to come on too to see other people that have survived it.
Yeah,
Um,
me.
so yeah, I know. I want to get to know you too, Susan. I know. So that's the quick version. I didn't want to go too long, so I will let Susan talk now. So
Thank you,
Okay.
April.
you're welcome. I'll just put myself on mute here. Oh, I was
Perfect.
going to
Thank you
show some
so
pictures.
much.
Maybe I'll do that in a little bit here.
Okay.
Am I up next? Okay. I wrote something out. Hopefully it's not too long. I was born on Friday the 13th in October in New York. Hospitals didn't have any technology at that time, so doctors didn't know if anything was wrong until the mother gave birth. Our doctor, Benjamin Pollitt, explained to my dad that since I was full term and came out screaming, he thought he should give it a shot. Left alone, I would die anyway, so they had a 50-50 chance. In the 40s, 50s, and 60s, they really tried to save babies with severe birth defects. I had what they then termed a huge O with everything in it. My dad told them to try. They stabilized me, had me baptized, and then given the last rites. While that was going on, a few family members went across the street to the funeral home to set up my funeral. And at 2 hours old, they pushed everything back in and sewed me up. There were no NICUs or PICUs in those days. It wasn't until sometime in the mid 60s that you had NICUs and PICUs. I was in a covered bassinet in a nurse's office. They had an NG tube in to feed me, but there were no other needles or tubes for babies. They had to just wing it and go on the fly. I vomited up lots of blood the first few days, and they transfused me by using syringes filled with blood going right into my veins. Dr. Pollitt said when he went in the day after I was born, one of the nurses was coming out of the office and said, "She's still here." He felt that I might actually make it. I was in the hospital for about 2.5 months. My parents were allowed to visit, but could only stand or sit in the hallway and look at me. They weren't allowed to come near me or touch me. When I was released, they pulled the NG tube out and just handed me to my mom, who then had trouble getting me to feed. I had a hernia repair at age 2.5 years old. And the summer before I started kindergarten, my mom asked about muscles. Up until then, I had something called a truss holding my stomach in. So that summer, they stretched my back muscles to the front, and that was my muscle closure. Needless to say, I don't have anything like a strong core or back muscle. I was fine till about age 12. From then until I was 28, I had seven serious bouts of blockages and adhesions, which landed me in the hospitals with operations. They also found out from GI tests and bariums that my body wasn't breaking down fiber, and in my late 20s, they put me on a low residue diet. They also found out that I had very slow digestion, which affected my eating and weight gain. Life calmed down after that. I got married in 81. I had my son in 1986. He was born on Valentine's Day. He's my Valentine baby. Um, And I saw a high risk doctor, but it went like a normal pregnancy. My organs are malrotated, some are fused together. My heart's on the right, which is called dextrocardia, and it's tilted towards and more into my back. My right kidney is small and in a very weird place, basically right next to my heart, but it's working. My left kidney is not in the proper place either, but the doctor said it's in the ballpark. I have 80% lung capacity and a duplicate inferior vena cava. The usual growing up, didn't really eat much, always very thin. That was until I hit menopause. Now, of course, I'm overweight. Um, Dr. Pollitt was my doctor until age 10. We then moved to Long Island. In my early 20s, when I went to visit some relatives, I stopped into his office. I asked the secretary not to give my name. I would introduce myself. I went into his office and said, "Hi, Doc. I don't know if you will remember me." He stopped me mid-sentence and said, "Oh, Susan, how could I ever forget you?" I visited him several times after that, and that's how I learned most of my medical history. My parents wouldn't talk about it. I have since found out I have a very mild case of pulmonary hypertension, which isn't bothering me, and a slight case of scoliosis. Also, very long, skinny lungs, which is the cause of my breathing issues. Most of my issues now are more age related than O related, though I still have bouts of constipation, but just drink more water and cut back on eating. However, last year I did have a partial blockage, and I'm getting over now a partial blockage I had 2 weeks ago. I would like to acknowledge my mother's side of the family and my dad. In the 1950s, while the birth was covered, operations on newborns weren't. You had to be several months old before medical would cover it. The hospital wouldn't release me until the bill was paid. No charity or religious entity would help them. My mom's, I get really verklempt with this because it's really good. My mom's 8 siblings and her mother handed over what savings they had to pay the bill. My dad worked 3 jobs for 12 years to pay everyone back, not to mention pay our rent, buy us a house, put food on the table. There were some rough times, but we all helped one another and we made it through. Um, because of the because of the moose site and the adult O site, there are about 15 either adult O's or pregnant moms with O's or old children, which luckily I have met almost all of them in the last several years. We used to have lunches up until COVID, that kind of stopped it. But that was really good to actually find like my tribe, that we had, that there are other people out there, because for 60 some odd years, I thought I was the only one out there. Also, because of better technology now, similar to April, when I would go to sleep at night, I would wake up sometimes having a lot of trouble breathing and thinking I was going to pass out, and would scare the bejeebers out of my parents and even my husband a few times. And I got sick several years ago. And while I was in the hospital, they did a lot of research, which is how they found out I had such long, skinny lungs. And that when I slept, my oxygen levels went down, sometimes in the low 70s and sometimes actually hit the high 60s, which is not good. If you put a pulse ox on me, my oxygen levels usually would be in the low to mid 80s just during the day on a good day. But since they discovered that, now I use a machine at night. I have an Inogen portable on my nightstand, and I use the oxygen, which really has helped me during the day as well. Now, if you put a pulse ox on me, the levels actually read 90 or 91, which is, my doctor's like, whoop, whoop, that's so good for you. And it does help me walking. And I have a portable one in case we go on, 5 or 6 mile hikes. At least if I feel like I'm getting a little congested, I can just whip that out and put the oxygen in, and has a little, it's like a cross pocketbook bag type thing. And it just gets me through the day, which with all the modern technologies now, they're finally doing all the things that, babies today are having, which are helping me, at least in my old age here, since I'll be 75 in October. I can't believe it, but here I'm still here. But that's my story, and I hope it helps somebody.
Thank you so much, Susan, for sharing. So I will go ahead and stop our recording and then we'll open it up for questions.